That's all the detail. Let me step back for a minute and talk about measuring and reporting on performance and putting that information into the public domain. Because if our intentions are quality improvement, you could actually have access and use information within a system and not put it up on a website and make it publicly available. You could actually do a lot of work around sharing information and have accountability by sharing information across different levels and types of accountability relationships we have in our system. So why would we want to make all of this transparent? Well, there's evidence I'll get to in the next slide that a focus on transparency and on a liberalization of understanding about how we're doing and variations in practice and variations in care and variation in outcomes, in fact, stimulates the motivation within all of us to provide the best care for patients. But the transparency part of health reform in Australia and other countries is an emotive context. So I want to understand that, or talk about that from the patient's perspective, and then let's talk about that from a clinician and management and health system manager perspective. From the public's perspective, it's my view that they make a big investment in their public and private sectors because they want high quality, safe care when they need it. And most of us are healthy and we don't need it, but we still make investments because we know there's people in our community that need it a lot more than us. And we also make those investments for a viable, sustainable system because I know I'm aging and I know I'm going to need it in 20 or 30 years. And I'll say that for the next 20 or 30 years. But there's signals in the marketplace that things aren't as good as they could be, or that things don't cost as much as they might, or that the costs in the future might not be sustainable. Well, that would bother me, and I think it bothers a lot of people in the public. So what the public want and what we see, particularly in New South Wales, releasing bureau reports, you see an insatiable demand in the public, as we see through the media, and more insights and more understanding about a system and service that they really care about. They care about it for themselves, they care about it for their family, and they care about it for their community. And so the movement in all countries, and I just personally think also in Australia, is to close the gap between that interest in wanting information to ensure that they have a sustainable, viable, vibrant system so that you can get high quality, safe care when you need it, drives our interest in transparency. So on the clinician management system manager perspective, it takes a tremendous amount of courage to be transparent about the performance of a system. But you know what? One thing's inevitable. We will not all be better than average, right? Because we know that there's always variation in practice, and the public knows that too, because there's always variation in service delivery in every other sector. But what they want is us to be transparent about that and rally around and celebrate our colleagues who can show us the way because their practice is better than average. And they want us as a community to rally around our colleagues who have a practice who for the first time they found out was not better than average, so we can help them out to improve their care. So there's this relationship now to be strengthened, I would say, for the next couple of decades that requires a lot of courage on our part to build a lot of confidence on their part that they're going to get high quality, safe care when they need it. So the impact of public reporting relates to that relationship, to strengthen confidence that you are providing the best high quality, safe care that you can, and that people will have it when they need it, and their families will have it when they need it. But there's another impact from our experiences internationally in our community about the impact of public reporting is, boy, is there an appetite for comparative reporting particularly when you name organizations, when they find out that they're not better than average because they all think that they are, because that's what's inherent in our work, to provide best care for patients, that they rally around themselves as a team, and they ask for assistance and we provide it to them so that we can all work towards better practice for every patient. We've seen evidence in international literature. Here's some examples of types of services. When we release performance information and outcome information about patients, we really see a bend in the curve on a quality trajectory that was already there, things getting better and better and better, and it gets accelerated with the release of public information where it's from a trusted, credible source and it's comparative information.